This episode of the Senior Rehab Podcast is sponsored by the Academy of Geriatric Physical Therapy. AGPT's mission is to further your ability to provide best practice physical therapy and to advocate for optimal aging. How do they do this? Well, one way is by connecting like-minded individuals around a specific topic. We call these special interest groups, or SIGs. One SIG is a health promotion and wellness special interest group. I highly encourage y'all to check out some of the work they've done, especially with their presentation on physical activity, a key to successful aging. You can access this presentation for free and learn about how the AGPT can further your clinical practice at geriatricspt.org/SRP. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Hey y'all, welcome to Home Health Recharge. This is your host, Troy Mead. Today we're going to dive into the proposed Oasis D. We're going to look at what's coming and going in regards to when you compare Oasis D to Oasis C2. But first we need to talk a little bit about what's driving these changes. The two big reasons for these changes are, number one, continued compliance with the Affordable Care Act. You may have noticed that that was really the driving force in a lot of the changes in the C2 set as well. And number two, the Patients Over Paperwork campaign, which is really aimed at reducing the burden of paperwork for healthcare workers. And now with that in mind, let's look at what's leaving. The first thing you'll notice is that there's been 28 M items that have been removed from the Oasis. Now this is a variety of different items that have been removed. Some of them are just quick yes or no questions. Some of them require a little bit more time. But the really quick hits to kind of note right now was M1011, which is the inpatient diagnosis. This one was a little bit more time consuming. M1017, which was the diagnosis requiring treatment change. Another one that was a little bit more time consuming. M1025, which was the optional payment diagnosis. M1034, this is the overall status. M1210, M1220, and M1230, which were those questions that were in a row, which addressed the patient's hearing, understanding speech, and ability to speak. M1300, the assessment for pressure ulcer risk, was a yes or no question that has been eliminated. M1302, the risk for pressure ulcer is identified, also been eliminated. M1313, the worsening in pressure ulcer status, which is another larger question. M1320, the healing status of the most problematic pressure ulcer. M1350, which was the skin lesion or open wound question. M1410, regarding respiratory treatments. M1501, the symptoms of heart failure, which was another larger question. M1511, which is the heart failure follow-up. M1615, which was the urinary incontinence occurrence. M1750 was the psychiatric nursing services, which is the quick yes or no answer. M1880, the ability to plan and prepare meals. M1890, the ability to use the telephone. M1900, the prior functioning ADL/IDLs. M2040, prior medication management. M2102, A through E, start of care. That's the assistance available for ADLs, IDLs, medication procedures, and equipment. M2102, B and E on the DC, which was the assistance available. And M2430, which is the reason for hospitalization. And M0903, which was the date of the last home visit. So again, if you look at the conglomerate of questions, I think overall, even the quick ones, since 28 was eliminated, in the age of electronic documentation where space is a commodity, I think this will save us time overall on waiting pages to refresh so you can document, as well as some of the really larger questions where you had to dive down and look into what CMS was asking and how to answer it. So even that will save you some time there. So overall, with a lot of these changes, Medicare estimates that you'll save around a little bit over 11 minutes with the changes that have been implemented. So now that we've looked at what's going away, we need to take a second to kind of look at what are they adding, what kind of questions, because they're adding 6 questions to the Oasis D item set. So they've added 6 questions overall, 4 GG questions, and 2 J questions. Looking at these questions from a therapist perspective, these are really kind of questions that are right up our alley. They're really intuitive. I feel they're really intuitive to our profession and kind of how we evaluate our patients in the first place. So as a therapist, I don't think this is going to add a lot of time or a lot of frustration to our Oasis. So let's look at what they have. So let's look at the first one. It's GG0100, and this is prior functioning of everyday activities. Okay, so off to a good start. I mean, that's something we do all the time anyways. So there's 4 boxes to code 4 questions, and the coding is like this. 3 is they're independent, 2 is they need some help, 1 is they're dependent, 8 is unknown, and 9 is not applicable. So what are we coding? So if you look at what we're coding, we're looking at self-care, indoor mobility or ambulation, stairs, and functional cognition. So those 4, we're coding those as either independent, need help, dependent, or some form of we weren't able to assess. All right, so far so good. So let's go on to the next GG question, which is GG0110. Prior device use. That seems pretty straightforward. So on this one, there's 6 options, and you check all that apply, which includes manual wheelchair, motorized wheelchair and or scooter, mechanical lift, walker, orthotics prosthetics, and none of the above. So that's a pretty easy question to answer. So far we got 2 down. So let's go on to the next 2 GG questions. And I'm lumping these 2 in together because they are very similar. It's GG0130, self-care, and GG0170, mobility. And these are 2 charts where you're coding the patient's performance on start of care or resumption of care and the discharge goal. So with that, your options are independent, setup or cleanup assistance, supervision or touching assistance, partial/moderate assistance, maximal assistance, and dependent. And then there's a few other codes for why you weren't able to rank them on their performance. So with that, with the self-care, what you're ranking is eating, oral hygiene, toilet hygiene, shower/bath self-care, upper body dressing, lower body dressing, and putting on or off footwear. And with mobility, you're assessing the ability to roll right and left, sitting to lying, lying to sitting on side of the bed, sit to stand, chair/bed to chair transfer, toilet transfer, car transfer, the ability to walk 10 feet, the ability to walk 50 feet with 2 turns, the ability to walk 150 feet, the ability to walk 10 feet on uneven surfaces, 1 step or a curb, and 4 steps. Okay, so that was our GG questions. All these GG questions are looking at the patient's function, whether it's how they performed on start of care, what your goal at discharge is, or how their prior level of function was. Alright, so we're not doing too bad so far. And now we're on to the 2J questions. And these are really quick, simple questions that shouldn't take a lot of time. So the first one is J1800, which is, has the patient had any falls since start of care /resumption care? So this is a discharge question. and you simply answer yes or no. And then that leads into J1900, which is another new question, which is the number of falls since start of care / resumption of care. And this is another one where you code it. There's 3 questions, and you either code it 0, which is none, 1, which is 1, 2, which is 2 or more. So the 3 questions are, how many did they have with no injury? How many did they have with an injury except for major? And then how many did they have with a major injury? So overall, the J section, not a lot of time consumption on these 2 questions. There is a little controversy around these 2, more than the other ones at this time, over the concern that in home care, we're not with the patient 24 hours a day like they are with another post-acute setting, like skilled nursing facility. So there's some debate and discussion on how this information will be used to compare us in home health with other post-acute settings. So overall impressions of the whole Oasis D, I do think it accomplishes its goal of being more compliant as well as being more time efficient for clinicians with the elimination of questions that weren't used in calculations for value-based measures. And I think the new G questions as well as the new J questions are pertinent to our care and something that we're pretty much assessing anyways when we go in to see a patient in their home. But I want to reiterate that these are still in a proposal state, and you have until May 11th to make any comments to CMS about changes that you would like to see made. Now, in the past, CMS has been very receptive to comments and changes. They have helped a lot when we were working with HHGM. So I encourage you, if you really want to make an impact and you really want to hear your voice heard, that you should really try to make some comments about this Oasis set. So that's all I have for today. I hope you enjoyed and come away with this with some more knowledge about what is contained in the new Oasis D item set, as well as inspired to make comments as needed. Until next time, don't forget to stay funky.
Hit me! Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.